Co-creation of goals and outcomes. The co-creation of goals and outcomes in therapeutic settings represents a paradigm shift from traditional therapist-driven models to collaborative engagements where both therapist and client actively participate in defining the trajectory of the therapeutic process. This collaborative endeavor aligns with contemporary understandings of the therapeutic alliance, emphasizing shared decision-making and mutual respect. The concept is deeply rooted in the client-centered approaches pioneered by Carl Rogers, which underscore the importance of empathy and unconditional positive regard in fostering a therapeutic environment conducive to change. However, co-creation transcends mere client-centeredness by integrating systemic, cognitive behavioral, and narrative frameworks, thereby offering a multifaceted approach to therapy. In practice, co-creation necessitates an advanced skill set that enables therapists to navigate the delicate balance between guiding the therapeutic process and empowering clients to articulate and pursue their aspirations. It requires a sophisticated understanding of the client's cultural, social, and psychological contexts, as well as a comprehensive grasp of systemic influences that may impede or facilitate goal achievement. This is where the therapist's role transitions from an expert who imposes solutions to a facilitator who supports the client's exploration and realization of their potential. Theoretical insights into co-creation can be drawn from social constructionism and narrative therapy, where meaning-making is a collaborative process between individuals within a given social context. By leveraging these frameworks, therapists can assist clients in reconstructing narratives that align with their desired identities and outcomes. This involves deconstructing dominant discourses that may have historically disempowered the client and collaboratively constructing alternative narratives that reflect the client's values and aspirations. Practically, therapists can implement co-creation by initially engaging in thorough goal-setting conversations that are characterized by open-ended questions and reflective listening. This process involves eliciting the client's intrinsic motivations, values, and visions for their future, thereby ensuring that the goals are personally meaningful and contextually relevant. Advanced practitioners will employ strategic frameworks such as SMART goals while remaining flexible to accommodate the evolving nature of the therapeutic journey. The co-creation of outcomes is not merely an endpoint, but a dynamic process that necessitates continuous evaluation and adjustment. This involves periodic reviews of progress, where both parties assess the effectiveness of the strategies employed and make necessary modifications. Such reviews should be underpinned by a spirit of inquiry and curiosity, allowing for the emergence of new insights and directions. Here, the therapist's role is to facilitate a reflective space where the client feels empowered to question and refine their goals without fear of judgment or failure. Pause. Competing perspectives on co-creation emerge from debates around therapist expertise and client empowerment. Cognitive behavioral approaches, for instance, traditionally emphasize the therapist's role as a guide who applies structured interventions to elicit change. Critics of co-creation argue that without expert guidance, clients may set unrealistic or detrimental goals. However, proponents of co-creation contend that when clients are actively involved in goal setting, they are more likely to be committed to the process, thereby enhancing therapeutic outcomes. The key lies in integrating the directive elements of cognitive therapies with the collaborative ethos of co-creation, ensuring that therapeutic interventions are both evidence-based and client-driven. Emerging frameworks such as acceptance and commitment therapy offer novel approaches to co-creation by emphasizing psychological flexibility and values-driven action. ACT encourages clients to accept their thoughts and feelings while committing to actions aligned with their values, thereby fostering a sense of agency and resilience. This approach is particularly relevant in co-creation as it empowers clients to define outcomes based on personal values rather than societal expectations, enhancing the authenticity and sustainability of the therapeutic goals. Pause. Case studies provide illustrative examples of how co-creation can be effectively implemented across different contexts. In a recent study involving culturally diverse populations, therapists employed a co-creative approach to address cross-cultural barriers in therapy. By collaboratively setting culturally sensitive goals, therapists were able to build stronger alliances with clients and achieve more meaningful outcomes. This case underscores the importance of cultural competence in co-creation, highlighting the need for therapists to be attuned to the cultural nuances that influence client perspectives and motivations. Another case study examined the application of co-creation in organizational settings, where therapists worked with teams to develop shared goals that aligned individual aspirations with organizational objectives. This approach not only enhanced individual well-being, but also fostered a sense of collective purpose and cohesion within the team. By integrating co-creation into organizational development processes, therapists can facilitate systemic change that extends beyond the individual to impact broader social structures. The interdisciplinary nature of co-creation highlights its relevance across various domains, including education, healthcare, and community development. In education, co-creation can empower students to engage in self-directed learning by involving them in the design of their educational pathways. In healthcare, co-creation can enhance patient engagement by involving patients in the development of personalized care plans. These applications demonstrate the versatility of co-creation as a framework for fostering agency and collaboration across diverse settings. Pause. In conclusion, the co-creation of goals and outcomes represents a sophisticated and dynamic approach to therapy that leverages the strengths of both client and therapist. It requires a deep understanding of theoretical frameworks, advanced clinical skills, and an openness to continuous learning and adaptation. By embracing co-creation, therapists can foster therapeutic relationships characterized by mutual respect, shared purpose, and transformative change. Pause.